Welcome to listen to QA Dental original podcast series Karonkka. I'm dentist Mikko Nyman. Today our guest is microbiologist Qingru Jiang, who has graduated as doctor from the University of Helsinki in September 2020. Qingru's doctoral dissertation topic is Probiotics in Oral Health, interactions between probiotics and oral biofilms. Welcome Qingru, and thanks for accepting our interview invitation.
Thank you.
Could you tell us a little about yourself and your occupation first?
My background is microbiology. I have started my microbiology study from the year of 2008 when I did my thesis for the bachelor degree. And then I went to my master study. The topic is about probiotics, its application. And then I came here for my PhD study.
Okay, Excellent. So let's go then to the project itself, not to the substance yet, but how the project went with you. So did you choose this topic that's at least partly on dentistry by accident, or was some professor recommending that topic for you?
I selected this topic mainly by myself. First, because my background is probiotics, and the microbes living in the nature mainly as biofilms, and the most studied biofilms is in the area of oral biofilms. Then I Googled and I found my supervisor, Professor Jukka Morman. He was also interested in this topic. Then we have this study. Yes, the other supervisor also interested in this topic, and then we have this study.
Who was the second supervisor?
I actually have three supervisors.
Okay.
Professor Jukka Morman, Professor Rita Kolpela, and Dr. Iva Stamadova.
Okay. Was there some other team members, important team members in your project?
Yes. In my 4 publications, I have other co-authors. They are Gilsti Kali, Dr. Vera Kainunlainen, and Dr. Sokya Song Kim.
Okay. So one more thing about this. They are doctors, but now I wonder, are they like dentists, medical doctors, or doctors?
The doctors here, I mainly mean the PhD degree.
Okay, PhD, yeah.
Yes.
Okay.
But actually they are almost dentists.
Yes.
Except Gilsti Kali.
Okay. So when did exactly you start this thesis project?
This project was started in October 2012.
Okay.
I remember the first day I came to Finland is on the 25th of October.
Okay. So you started working right away.
Yes.
Yes. And then could you tell a little how this research was conducted? By this I mean, was it more, did you do lots of work in laboratory or with computer?
I did most of my work is in the lab. And then I collect the results and measurements and analyze this data by computer. And I used microscope, so I also need the computer's help.
Yes. Okay. Where is this lab physically? Is it in Viikki?
It's in Meilahti.
In Meilahti. Okay.
Yeah, in Biomedicum.
Okay. Yes. So you had to then collaborate with the dentist anyways. At least Jukka, he's a dentist. So what kind of information did you need from clinicians in order to move forward with your research?
I need to know what kind of bacteria can cause the oral diseases, and these dentists know more. And they know what is more important nowadays, because the diseases are, because people use more antibiotics, so the diseases might be a little bit different from 20 years ago. So now we also interested in the diseases caused by Candida albicans.
How many publications did you do?
In my thesis, it includes 4 publications.
Yes. And were these publications in dental journals or microbiology journals or both?
Half.
Half.
The 2 publications are published in mainly microbiological publications, and the other 2 are caries research and also a new journal, dentistry journal.
It's a quite big work to do the thesis, and we are also interested in knowing that how you manage it's economically. Did you receive probably some grants also?
Yes, I got several grants to support my study. First, before I came to Finland, I got the grant from China Scholarship Council, which provides the grant for 4 years, which allows the project could be started. And I also got scholarship from Selma and Maja Lisa Selander's Fund for Research in Odontology, and grants from the Finnish Dental Society, Avalonia, and the Finnish Dental Foundation.
Okay.
Yes.
Okay. So was it like a full day job all the time, or did you do other work also?
It's mainly full-time study.
Yeah. Many dentists, when they do the thesis, they work partly as clinicians also. So it's I also always wonder that it's quite challenging because you still have to do the study.
Yes, it is quite challenging if you have to work in other area.
So then let's go to the thesis defense event. Was it very stressful event when you had to?
For me, it was stressful.
Okay.
I didn't fall asleep at the night before the dissertation.
Okay. How long was the event?
It was on Friday. I didn't check the clock, but mainly 2 hours and a little bit like that.
Okay, that's a memory that you won't forget, probably.
Yeah, I will remember it forever.
Yes. Did you organize this Karonkka, this traditional party, after party? That's the name of this podcast series.
I have this Karonkka dinner, but in a very small group because of the
Corona situation.
Because of the Corona situation. In the dinner, we only have 5 people. The opponent, Gustos, 2 of my supervisors, and me.
Okay.
And my 3rd supervisor is also invited, but she lives in United Kingdom.
Okay.
So it's not difficult. It's very difficult for her to come.
Okay. So now that the project is behind, how do you think you benefited the most from the project? I mean, what is the most important lesson you maybe learned during this project?
Because there are some clinical studies prove probiotics is able to inhibit or reduce the growth of Candida albicans in patients' mouth. And my study confirmed these results in the lab condition. I think that's the main result.
Okay. Does this doctoral thesis open new or some other kind of work opportunities for you also in microbiology?
You mean if I got more questions from this study?
No, I mean just when you have this doctoral thesis done, does it open new doors for you, like in professional way?
I believe so, because my supervisor, Professor Rita Golpela, she says a doctor degree is like a driving license. Now all the door is open to me, but because it's just 1 week ago,
yes.
So I haven't started to search the postdoc position and other academic position, but I will do it when I have more time on it.
Thank you very much for telling us about your project. Now we can go to the content then. So me as a dentist, I have seen and treated quite many Candida albicans infections during my clinical career. It's very interesting to hear what we clinicians can learn from your thesis. So let's delve into the dissertation content. So first, if we start, what was your study hypothesis?
My hypothesis was that the probiotics, it can integrate into our biofilms, interact with species in the biofilms, and alter its pathogenic potential, all of which further reduce the growth of biofilms and thus reduce the burden of common infectious oral diseases.
Okay. And what learned from the abstract was that first you evaluated the inhibitory activity of 6 commercial probiotic lactobacilli against Candida albicans. So what were the results from this evaluation?
The result is the probiotic Lactobacillus rhamnosus GG, which is well known as LGG, shows stronger inhibition against Candida albicans than that of Lactobacillus brevis, Gassi, Reuteri, and Bulgaricus.
Okay. And next you assess the potential risk for lactobacilli on dental hard tissues. This is very important and interesting for a dentist. So what was the conclusion in this assessment?
From my study, LGG did not significantly reduce the pH value because pH reduction can be a risk for the caries. But my results confirm that LGG is safe for people to use.
Okay. How was this LGG given to patients? Do you mean like normal tablets of? Or
you mean the delivery format?
Yes.
There is no conclusion which is the best way to use. Because in the studies, the researchers use different formats, like what you said, tablets. Someone used lozenges, or also added into the food, ice cream, cheese. They are all possible delivery formats.
And then third, you investigated the growth of opportunistic oral pathogens in the presence or absence of Lactobacillus rhamnosus GG. So what were the findings in this research?
My findings are mainly that the LGG inhibited the growth of Candida albicans, and they influence the growth of other pathogens in different ways. Sometimes reduce their growth rates, sometimes reduce their adhesion ability, but it all depends on the composition of the biofilms.
So if it reduces the growth of Candida albicans, it could be helpful for patients who have constant problem of Candida albicans infections in their
Yes,
mouth.
from my study, the result is quite strong that support the growth the LGG can inhibit the growth of the Candida albicans.
Okay, that's very interesting. And you also last you evaluated the LGG's effect on commercial mouthwashes. Was there some effect?
Actually, in my study, LGG didn't enhance or weaken the antimicrobial effects of mouthwashes on the pathogens. And I think this is the result that we are happy to see. Because these commercial mouthwashes are sometimes important for some people to use in daily life or for short time. LGG is regarded as a probiotic strain. If LGG shows a weakened effect, then some people are not happy to continue to use the mouthwashes.
At least what I have learned in Finland, commercial mouthwashes are not recommended very much. Usually when mouthwash is used, at least that's my opinion, are the chlorhexidine mouthwashes, but that also kills Candida albicans.
Yes.
That chlorhexidine. But I know the mouthwashes are widely used anyways.
Yeah, in some other
in world, yeah.
places.
So if we now summarize, in your opinion, what is the most relevant finding in your thesis that every dentist should know when they do their clinical work and treat their patients?
Actually, my study is based in the lab condition. I am not that confident to give really strong recommendation for dentists to use in the clinic. But according to my study, LGG is safe for the use to prevent caries. And it shows beneficial effect to inhibit Candida albicans. Yeah, I think that's two main results.
I'm wondering how effective it is in inhibiting the Candida albicans growth, because I'm wondering should it be recommended for patients who suffer from these Candida albicans infections. Usually they have patients who have a removable prosthesis. So I'm just wondering if it should be like recommended for patients.
I think first, if a patient is very ill, the situation is really not good, then it's not recommended to use bacterial therapy because the probiotics are alive cells. But if the people is generally healthy or a little bit mild syndrome, then it might be good to use probiotics. And like what you said, if the dentist want to get more recommendation of how to use probiotics LGG, then probably more studies are needed.
Yes.
Like the dose and how often to use it needs more studies.
So if I want to use LGG, not for Candida albicans prevention, but for other uses like for stomach and all the other benefits. So it is anyways like you mean it's the same tablet, same amount of the LGG that you should take, or is it like some other product for oral use?
There might be different because the oral cavity is a little bit different than the gut. And when we swallow the food or the tablets, we hope the probiotics can stay in the mouth for longer time so that they can interact with the bacteria in our mouth.
Yeah, you like have to chew it and then slowly.
Yes. If you just like swallow water, then just take 1 second. Yeah. That's too short for the interactions. But the dose and other things might be a little bit different to use in the gut. And the species may also change. I mean, there are many species available in the market. But now I don't know which is more suitable for which disease.
Maybe some young interested dentist in this research could take this information and start trying with patients also.
Yes.
More clinical studies.
And now many researchers believe it's not a good idea to prescribe one probiotic to all the patients or everyone, but it's better to tailor-made because people have different patterns of the bacteria and other microbes in the gut or in the oral cavity.
Okay. So you have to do some examinations for the patient before you know which probiotic is suitable for.
The research has not yet, I haven't seen many people study this, but it's a good idea to have future studies.
Yeah. Okay, then last question about this whole project and a doctoral thesis. Would you do this all again if you knew how much work was required and how extensive project it was?
If possible, I would like to add some other studies in. But all these insights are also very important as a background. And it's also good to have more studies in some areas because my study mainly talk about the composition of the biofilms. But it's also important to study the metabolic profiles in the oral biofilms. That's what I want to add in future.
So are you going to do more studies in the future?
Yes, hopefully, if I got more grants.
Excellent. So we will have you here again.
Hopefully.
Okay. Thank you for your excellent work and contribution to dentistry. And thanks for the interview.
Thank you. It's really happy to be here.
Our next guest is dental specialist Peter Rusonen, who did his doctoral dissertation in the University of Helsinki. Goodbye.